A cold or cool, wet environment can result in a lowering of internal body temperature. Hypothermia and frostbite are the most dangerous cold-related conditions. Frostnip is the freezing of superficial skin layers. The skin feels numb and looks white. Rewarm the area as soon as possible using skin-to-skin contact.
How's your hand doing?
I've been trying to get it warm, but my fingers are pretty numb. I probably should have took the wet glove off earlier.
Frostbite occurs when deep tissues freeze. Body parts that are commonly exposed to extreme cold, such as the fingers, toes, earlobes, cheeks, and nose, are the most likely skin to be affected. Contact with metal accelerates freezing and is particularly dangerous. Early signs of severe frostbite include burning, numbness, and tingling skin that appears white and frozen. Blisters may form. Do not rub frostbitten skin or apply snow or ice to it. Do not disturb blisters.
You need some help? My buddy's glove got messed up. I took it off, and now his fingers are numb.
It took us a while to get here.
Can I take a look?
Sure.
Yeah, it looks like you may have frostbite. I can help.
Okay.
If you suspect frostbite, get the person to a warmer place. Remove any wet clothing from the affected area and dry the skin. Remove any constrictive jewelry. Do not rewarm the frozen body part if there is any chance it may freeze again. The thaw-refreeze cycle is very harmful. It is safer to keep the affected part frozen. Place dry gauze pads between frostbitten fingers and toes. If gauze dressings are not available, use any clean material available, such as clothing, a towel, or other material to keep the body part still and protected. If you are more than 2 hours from professional medical care, rapid rewarming is recommended. Immerse the frostbitten area in warm water for 20 to 30 minutes. The water should be 98.6 to 102.2 degrees Fahrenheit or 37 to 39 degrees Celsius. If a thermometer is not available, test the water temperature by placing your hand in the water for at least 30 seconds to confirm that the temperature is tolerable. Other heat sources, such as chemical warmers, fire, or heated rocks, should not be used due to risk of further injury from thermal burns. Check continuously and keep the water warm at the recommended temperature. Severe pain, substantial swelling, blistering, and tissue color changes should be expected. When rewarming is complete, use bulky, dry gauze dressings wrapped loosely on the thawed parts to protect it and allow for swelling. Elevate the affected body part if possible. Do not let the person use the affected body part after it is thawed. Have the person evaluated by a medical professional as soon as possible. Hypothermia is an abnormally low core body temperature, defined as 95 degrees Fahrenheit or 35 Celsius or less. Hypothermia frequently accompanies frostbite and can be fatal. Signs of hypothermia include shivering, an inability to function well, a decrease in consciousness, or an altered mental status. If there is any doubt, assume that the person is hypothermic. Assess scene safety. The decision to rescue or to provide first aid for a potentially hypothermic person should only be made after the scene is safe. Take standard precautions. Assess responsiveness. Call 911 to activate EMS using a mobile device, or activate your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. If a person with suspected hypothermia is unresponsive, not breathing normally, or only gasping, start CPR. Cardiac arrest victims of hypothermia have survived with normal brain function after lengthy CPR efforts. However, do not start CPR if the person has obvious fatal injuries or if the chest is too stiff to compress.
Are you doing okay? You've been in here for a while. You should step out.
If the person is breathing and responsive but has an altered mental status, consent is implied. Keep a hypothermic person lying flat. Do not allow them to stand or walk. Handle them gently. Significant movement of the arms and legs can increase the flow of cool blood to the heart and increase the risk of cardiac arrest. Protect the person from further cooling. Use blankets, quilts, sleeping bags, or any available insulated materials. Cover the head and neck to retain body heat. If you are far from professional medical care, gently move the person to a warmer place. Remove wet clothes, preferably by cutting them off to minimize movement. Dry the person gently and cover them with dry insulating materials. Begin actively rewarming the person. Place warm, not hot, water bottles in the person's armpits. Apply a large electric heating pad or blankets to the chest and back. Avoid applying external heat to the arms and legs. Visually inspect the person's heated skin every 20 to 30 minutes for excessive reddening or other signs of impending thermal burns. If signs of burns appear, stop active rewarming in the affected area. Stay with the person until someone with more advanced training takes over or EMS arrives.